that this period of heightened vigilance will actually last until the end of 2016.
Okay, so it's a heightened vigilance. I mean, we look at the statistics. We talk about 11,315 people that died. The majority in Liberia, then Sierra Leone, and then in Guinea. We also had some outside of Africa. Nigeria had 8 deaths. But the reality is that there were 17,000 survivors of Ebola. What does that mean?
Well, it means that we are still learning a lot about this disease. We have never had so many survivors of an Ebola outbreak, and we are learning a lot about the virus. We're learning that people can essentially continue to have the virus in certain body fluids. We've seen this before with many other viruses, many other pathogens, but in previous Ebola outbreaks, we have not seen this before because we have never had so many survivors.
Yeah.
So we are identifying essentially which body fluids can continue to be infected with Ebola, for how long, and if and under what conditions Ebola can be transmitted to others.
Yeah, I'm reading a report from the World Health Organization of basically the lessons learned along the way, and I imagine a lot of lessons were learned, but the one that stands out for me was the WHO recognizing and saying that there was a failure to see that conditions for explosive spread were present right at the start, and incompetent staff perhaps could have been at the root of all of that. Talk to us a little bit more about this.
Well, certainly this is the first time that we've seen the Ebola in West Africa, and there were a number of conditions. We had weak health systems. Everyone recognizes that. The health workers had not seen Ebola previously in West Africa, so the health workers themselves did not know what to do with these patients when they first presented in the facilities. And many of the facilities did not even have the basic infrastructure, water, sanitation. This implies that we do not only need to look at surveillance systems and a management of outbreaks, but we have to look at the basic fundamentals of our health systems to make sure that we have people, well-qualified people in place at all levels of the system, but particularly the most peripheral levels, at the primary care levels, and make sure that those people are trained and that we have the infrastructure, water, sanitation, and protective equipment so that all health workers can implement basic infection prevention and control measures.
Yeah, budget was also one of the issues that was cited as one of the greatest challenges. Is this something that perhaps going forward people have learned lessons, and it's something that needs to be urgently attended to, and money needs to be sent into these areas desperately?
Absolutely. I think that was a critical issue. We have to have essentially, WHO is calling for a contingency fund of about $100 million US. And while this would not be sufficient to control an outbreak, particularly of this size, it would give us sufficient resources to get people on the ground immediately to be able to respond in the future to outbreaks and prevent them from going to this size and scale.
Here's a question I suppose that's quite important. What don't you know about the virus? Because we're talking 2 years here, and I imagine that there is a lot that still needs to be learned. For instance, we talk of these survivors, these 17,000 survivors. Is it possible that Ebola can reoccur in these patients?
Yes, absolutely, and that's what's happening now. We've seen now 10 documented previous small-scale outbreaks that are essentially Ebola recurring among survivors. There is a process now, we're doing what we call virus persistence studies among both male and female survivors to study this very phenomenon. Does the virus persist in different body fluids? Which body fluids? How long? And under what conditions can Ebola be transmitted through these body fluids? We are still learning a lot. We know that it can persist in semen, for example, and there's a special program of counseling and testing among male survivors to prevent reinfection among male survivors and transmission to others. However, we're still learning about other body fluids. We have one case in which the virus has been detected among breast milk.
Gosh. It's interesting. So breast milk and unprotected sex through men and semen. This is one way of actually spreading the virus. How long is it in the body for? Would it stay up to a year or perhaps longer?
For male survivors, we have cases in which the virus can persist to up to 1 year in the semen of male survivors. However, we do believe that this is rare, and transmission to others is rare. So again, we've documented 10 incidences in the past of the virus persisting in survivors and being transmitted to others. So it's relatively rare, but we are still studying the virus and we're trying to understand as much as possible at this stage.
If we have a look at the situation and how dramatic it was in those 2 years, and we look forward, can it happen again? Can it reach the epidemic proportions it did in West Africa?
Well, the global health community, including WHO, is doing everything it possibly can to prevent an outbreak on this size and scale. So we do believe we now have learned a great deal, particularly about Ebola, to prevent an outbreak on such size and scale. We do have the alert systems in place. The 3 countries continue to maintain heightened surveillance and their capacities to prevent an outbreak of this size and scale. And in fact, the fact that we know about this new case is an indication that those surveillance systems are up and running.
Yeah, indeed. Well, listen, thank you so much for updating us on the situation. And, you know, I think it's an incredible story to be reporting on, the fact that it's been eliminated, but there are still cases being reported, as in you did hear the one, and we still have to be exceptionally vigilant. Dr. Sarah Barber, who is with the World Health Organization here in South Africa, thank you very much for being our guest on the program.